Hi everybody, I'm Andy Rozak and alongside Jennifer Lee here with NACCHO. We're coming to you from the NACCHO Voluntary Retail Food Regulatory Program Standards Mentorship Meeting out here in DuPont Circle in Washington, D.C. We have a great group of 18 local health departments who have joined us for 2 days to talk about food safety issues. And Jennifer had a chance to sit down with some of the health departments to talk about how they're using the retail program standards in concert with their public health accreditation needs. So Jennifer, what are we about to see?
So you're actually going to hear from 3 different health departments with all different jurisdictional sizes, governance structure, and they're going to highlight some of their perspectives and some of their experiences as they're pursuing public health accreditation and making that connection with the retail program standards and drawing out some of the specific examples of how some of the public health accreditation board domains aligned with the retail program standards themselves. So it's really talking about how we can leverage opportunities between these 2 national initiatives as we recognize that in a challenging fiscal climate for many of our health departments, this is a great way where we can enhance leadership and make some progress at the national level for these 2 initiatives.
Well, and it's just another great example of how local health departments are getting the most bang for the buck out of these programs and really using programs in a complementary way with each other. So very exciting to hear. We've got a tremendous amount of resources on the NACCHO website. We'll put the links below so you can click on those. But you know, this food safety is a real big issue. 48 million Americans each year get impacted by foodborne illness, and billions of dollars. I think it was 14 or 16 billion dollars the last time I heard. So while not always glamorous, the work that's done every day at local health departments in keeping our food safe and making sure food preparation workers know how the proper ways and techniques of handling and preparing food is just so darn important.
Absolutely, and you also hear that with these 2 efforts, it's really embracing continuous quality improvement. And so with the retail program standards, that is the gold standard for many of these food safety programs. And again, it's just another way to recognize the good work that health departments are doing. Of the 2,800 local departments across the nation, we know that at least 75% of them have direct responsibility for either educating, licensing, or regulating food establishments. So what these group of individuals and agencies are learning will be definitely applicable to the other jurisdictions and their peers.
Well, and if that's one thing we hear time and time again, it's that local health departments love hearing from other local health departments, sharing their successes and even their challenges so that others can take those and run with them and grow their programs. So without further ado, let's go into that conversation, and we'll take you there right now on NACCHO TV.
Thanks for joining us on the podcast on connecting FDA's retail program standards and public health accreditation. The goal is to assist local department directors and staff with understanding the relationship between public health accreditation and FDA's voluntary national retail food regulatory program standards, or retail program standards for short. What we really want to do to achieve through this podcast is describe how the FDA retail program standards and public health accreditation complement each other and that are not mutually exclusive processes. And secondly, to apply knowledge regarding retail program standards to meet required documentation for the PHAB standards and measures. And so today I am joined by 3 local departments and I'll have them each introduce themselves.
I'm Mike Russell. I'm a Program Manager of Environmental Health and Safety at the City of Portland, Maine. We have a population of about 66,000 and we inspect over 500 licenses in the city.
Hello, my name is Jessica Lucas. I'm the Director of Environmental Health for the City of Bethlehem in Bethlehem, Pennsylvania. We are a population of around 75,000 individuals. And we inspect about the same, around 500 facilities a year.
And my name is Archer Campbell. I'm the Food Safety Consultant, District Standardization Officer for the Thomas Jefferson Health District in Charlottesville, Virginia. And we service about 5 localities in Central Virginia for a total population of about 225,000. We have about 1,000 food facilities in our annual caseload per year.
I'm Jillian Regan. I'm a public health data analyst, also at Thomas Jefferson Health District.
And this is Jennifer Lee. I'm the Director for Environmental Health and Health and Disability at NACCHO. And before we dive into a couple of questions, I'm going to give a quick overview and kind of set the stage for the podcast. So we know to date that there are nearly 600 food safety regulatory programs enrolled in FDA's retail program standards. And of those, actually 500 are local jurisdictions. Many of these enrolled programs work within a public health agency with a broader public health mission. Some of these agencies are considering or actively pursuing public health accreditation. At the moment, over 40 health departments have been recognized by the Public Health Accreditation Board, or PHAB, as high-performing health departments. For local departments that have not received this recognition yet, participation in the retail program standards may actually help to facilitate achievement of many of the PHAB standards and measures that a retail regulatory program would be expected to implement. As such, progress made by such programs to implement the retail program standards can translate into progress towards achieving accreditation to the PHAB standards. Accreditation defines expectations for local departments that seek to become accredited, document the capacity of the health department to deliver the 3 core functions of public health and the 10 essential public health services. The retail program standards guide retail food regulatory program managers in the design and administration of a retail food regulatory program. It also provides a means to recognize the accomplishments of the retail food regulatory programs. And as such, NACCHO and FDA collaborated to develop a crosswalk on the complementary requirements between the retail program standards and the public health accreditation. The crosswalk illustrates that participation in the PHAB process and the retail program standards does not need to be mutually exclusive. It provides an overview of the 2 initiatives and areas of alignment and shows how specific documents generated through participation in the retail program standards can be used to meet documentation required for the PHAB standards and measures. So with that quick overview, I'm going to ask a series of questions and be able to dive into some conversation here with our 3 local departments. So the first question is, how does the retail program standards and public health accreditation complement one another?
Well, they complement each other really well because there's many opportunities for win-win situations. Myself, I was working on the standards program, and there were other staff working on PHAB accreditation. And by using the crosswalk document together, we were able to identify many opportunities where we could collaborate together and meet both at the same time.
Right, to piggyback on what Michael just stated is for the PHAB domain number 2, you can use a lot of the standard number 5 investigative procedures. So we're all trying to minimize duplication, try to get the biggest bang for your buck of what you're working on, and I think the 2 complement each other in that way.
Well, we at Thomas Jefferson started the accreditation process about a year ago, and our management team, especially our medical director, saw the value of accreditation moving forward as a district for resource allocation and to help document our capacities in our district. And so when it was very easy to convince her that we wanted to get on board with the FDA standard, Voluntary Standards Program, as a way to document our capacities and our ongoing quality assurance and quality improvement in environmental health.
I could give a couple of specific examples of the win-win situations. One of them was the risk categorization of establishments for Standard 3, and that helped meet domain 6.3.2. So that was one piece. And another piece was the annual report that helped meet Standard 5, and that met domain 6.3.4. So those were 2 very specific examples where we could meet both.
And for us, PHAB measure 6.3.4 required an example of health department analyzing patterns, trends, and compliance from enforcement activities and complaint investigations. So one of the pieces we did as a result of Standard 4 was to develop a compliance strategy, enforcement strategy for our district. And so that dovetailed into the PHAB measures. And also the other one was Accreditation Domain 10.1.1 requires evidence-based practices to be used. So we used enrollment in the FDA standards to fulfill that grant requirement.
I believe overall, in short, both programs' main goal is for quality assurance. So I think that the basis of both programs complement each other in something as simple as that they're both trying to focus on documentation, quality assurance, quality improvement.
That's great. So it sounds like there's great alignment with just having been enrolled in the retail program standards and pursuing accreditation.
To emphasize what Jessica was saying is it really does establish a solid foundation for continuous quality improvement. Mm-hmm. With both programs, we're asking ourselves, how are we doing and how can we do better?
Great. So can you tell us a little bit more about how did each of your agencies get involved in your public health accreditation process? So maybe kind of draw out some of the details about specifically how your environmental health staff are contributing to this process.
Absolutely. We've been involved with the standards since around 2008, so it was an ongoing effort, and I believe our health director realized that getting reports on what we've done for the standards, she recognized very early that a lot of the things that PHAB is looking for, she knows that we've already worked on in environmental health. And in many of the domains, you are required to give 1 or 2 or 3 examples of certain measures that are lined out. And we already had a lot of those put together, at least on the environmental health aspect.
Well, a big piece of alignment for us, and when we were really brought in, was the strategic planning process. Each team and our core functions of the health department were brought in to do, there was a focus group where we each brainstormed as to our strengths and weaknesses, opportunities, our external forces that impact our programs, an analysis of our stakeholders that are all involved, and a review of all our mandates and data that we collected during the community health assessment and improvement processes. And so we were involved. Each team on our health department team was involved in the process from the beginning through the strategic planning process on. And so many of the standards that came forward with voluntary standards just fit right into the process all the way.
And at Thomas Jefferson, we were also involved, the EH staff, as well as just the regular health department staff, with something called a PHAB lab, which is like a weekly email with just a little bit of information about how we're progressing in PHAB, or just like a little bit of information about what it is exactly. That's another way to get the staff involved.
That's great. And that's weekly, or?
Yeah, it's weekly.
Okay. Well, great. And then my final question is, what advice would you give to your fellow peers in other jurisdictions that are also trying to make this connection between accreditation and the retail program standards?
I'd recommend sitting down with the crosswalk document that NACCHO created between the staff working on the PHAB accreditation and the staff working on the standards program, and work together to see opportunities where they can use common documents. And I'd also advise them not to stress about this, because many of the documents they don't need to create from scratch. There are already existing templates and models out there that they can adapt.
I would probably state to utilize the retail standards sharing community that already exists. And even if you're not currently working on a standard, if there appears to be something that PHAB requires, using our various sharing opportunities to see if somebody else already has something, that you can maybe begin a small portion of that standard to meet the PHAB requirement, and not necessarily have to complete the whole standard, but utilize what's out there. And to reiterate what Michael said, is just to use the crosswalk. Somebody already went through that, did the dirty work of trying to match the two. It makes sense just to utilize that.
Well, and it is a lot of data analysis. So you have to understand from the beginning that you have to have trained staff that know how to analyze public health data and assess it and keep track of it, because it's a tremendous amount of documentation that you have to track all along the way. And for us, we're based in a town that has a major university and a public health master's program, so we were able to use a series of interns that had just taken public health data analysis courses and had some experience, and that really helped us a lot along the way.
Well, I would really like to thank you for sharing your perspectives and your experience as you're making these connections between the retail program standards and accreditation. This is a huge momentum right now for not only local health departments but state health departments, and you know, all the better if we can leverage opportunities where it's benefiting, you know, the participation in multiple national efforts. So I also wanted to thank our sponsors, the Food and Drug Administration, and also to the Public Health Accreditation Board. It's been a great collaboration as we develop the crosswalk. I'm glad to hear that it's being helpful for you all, and then for some of the other jurisdictions that are also pursuing accreditation. And I wanted to thank those that are joining us on the podcast. So please check out the materials on NACCHO's website.